Hi, my name is Dr. Thomas O'Connor. Today, I'd like to discuss anti-aging. And this video is called Beyond Anti-Aging because anti-aging is very complicated. Longevity is very complicated. So, I'd like to address this today in this video. And you would have to start off with, first off, what is longevity and what's the basis for longevity and how someone lives a long life. So I've broken it down into a pie chart here, and I've summarized it down to 4 pieces. So there's 4 parts. There's genetics, there's behavior, luck, and diseases. Okay, so I give the most weight to behavior and diseases. Of course, you have genetics, and you have luck, circumstance, trauma. So if you look at this, it includes everything. So with someone with good genetics will certainly live a long life because they won't have heart disease. In addition to having good diet and exercise and not having bad circumstance and a trauma, in a car accident, they're going to live to 100 years old. So, and hopefully they're going to have a great quality of life. So in this side of the equation, the biggest piece is going to be behavior, keeping you free from having disease or multiple diseases. Of course, the pieces that you really can't do anything about so much, although down here with luck, this is very spiritual, is your genes, your mother, your father, and your heritage. Huge on the family history. When you just go to see a doctor, when I take a medical history, I ask about your mother and father. That is so important for your longevity, to see what's coming at you, because we can do a lot about it. The importance of having very good medical care. Diet, exercise, management of stress, exposure, which is basically occupational exposure, and life where you live exposure. Alcohol, drugs, and smoking. Behavior, huge piece that everyone understands. If you want to live a long life, these are the components. This is the mainstay. Next piece is, I love the luck and the trauma and circumstance when I thought about this, because if you're born with bad luck and you're born in a third world country, with all due respect to these people, it's bad circumstance. And then just because you're born there and if you stay there, your longevity is not going to be anything like if you live in a Western civilized country. So, very important pieces. Trauma. If you're the healthiest person with great genetics, you have no heart disease or cancer, and unfortunately you have a motor vehicle accident. So, this is it. This is the mainstay. This depicts a person's longevity right there. Hold those for a minute, and let's move over and let's talk about the management. And these are the tangible pieces. Well, doc, so what can you do for me in this clinic? People ask me all the time, doc, how are you? Are you an anti-aging doctor, or do you do anti-aging? What do you do? Because you're a testosterone expert, and they do that. So let's keep going on this thought. Diet and exercise, keeping stress down. There it is over here. There's no question about it. That's the mainstay. Preventing disease, we talked about. The #1 killer in the United States is heart disease. Then you get into the cancers, okay? And you move down, of course, infectious disease, hypertension, diabetes, and cholesterol, psychiatric disease. This all feeds back on some of these other aspects, working in with the behavior. Obviously, you can see how this whole thing is really a circular, aspect. It really, everything is hinging off itself. Apart from the genes, when you pick your parents, you pick them once, you're done. Okay, so the detection of disease. Primary care is the most important piece in my aspect. If you want to live a long, healthy life, and so many doctors, I know they agree with me, they don't know really what anti-aging really truly is, and a lot of them, for better or worse, they laugh at that. Unfortunately, they don't respect that, because in the real world of aging and understanding aging, it's about this chart right here. What can we do, though, about quality of life? Because beyond anti-aging, and anti-aging, where you have Botox and you have hormones being used, is this anti-aging? Absolutely not. It's a better quality of life, though. Let's call it what it is. Quality of life. You like to look good. Okay, we're going to talk about the drugs. Feel good, have great mood. You're going to feel strong. You're going to have energy and feel great. You're going to have great sex. and you're going to be successful because you're going to be a better salesman or saleswoman or a better business person because you have no brain fog and because you look great and you feel great. Now that is what I'm talking about, and that's beyond anti-aging. Quality of life, beyond all of this, because if you live to 75 but you have the best quality of life, how does that for you? Or if you live to 95, the last 10 years are a poor quality of life. Everyone understands this, and everyone tells me, my patients tell me this. So again, this you don't want to have. You want to stay clear of these diseases. How do you do it? Diet, exercise, reduction of stress, prevention and early detection of disease with great primary care. And that's, of course, what I do for my people. And I help manage them with primary care doctors. So, in the basis to go beyond anti-aging, we have to look at the quality of life, looking good, feeling good, having great sex, being strong, and being successful. So, what do we do? What do we have? What do we have in our bag? What do we have? What do these clinics have? They have testosterone, and this is all for men, of course. They have testosterone. Everyone gets testosterone, sure. We have human growth hormone, anabolic steroids, other peptides and other things. This is not Botox. This is really working on anti-aging with these drugs is manipulating hormones. This can be very dangerous. I mean, I'm not going to go into this during this video. So, testosterone replacement, absolutely. With me, if you're a proper candidate and we understand the benefits and the risks and we want to manipulate, we want to manage you on testosterone. This is so powerful. You've seen all my other videos about what testosterone can do, just testosterone. Adversely, we discuss the data with experts right in this room. To cardiac disease, prostate disease. So if you have heart disease or prostate disease, you're not going to be living a long life. So that's not anti-aging. But it's never going to be simple. It's going to be so complicated to look at these things. You really have to have a physician that understands how all this fits in together and just for you. Testosterone, important and incredibly, humbly powerful hormone and medicine. Human growth hormone, question mark, steroids, other question mark, all question marks. We know people use steroids. I take care of steroid users. I try to help them and see what the steroids is doing to their body, how I can help recover them and improve them and transition them potentially to testosterone if indeed we both feel that's appropriate. Other medicines, the peptides, growth hormone, we just don't know. We just don't know. There's just no data. There's not enough data for it. Can people feel they have better skin quality? Can they feel they have some lower fat in their abdomen? Can they feel stronger in addition to testosterone and steroids? Absolutely. Should it be discussed? It should be discussed. But we just don't know on those aspects with evidence-based medicine. So this is beyond anti-aging. I hope this is helpful. Thank you so much. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.